In this week's episode, we discuss New Jersey Naloxone distribution, battles against tobacco, and fraud settlements. Let's wrap things up. This is episode 101 for the week of September 6th. I'm Matt Moneypenny.
And I'm Albert Battistelli.
Before we get started, our diagnosis code of the week is W09.2XXA, or fall on or from jungle gym initial encounter. So you fall on a jungle gym, that makes sense. But fall from a jungle gym, where are you falling to if you fall from a jungle gym?
The ground, I assume. I don't know.
I'm gonna jump off the jungle gym onto this I don't know what that is.
I honestly think fall on is more confusing because it feels like, what, did you jump out of an airplane and land on a jungle gym?
Well,
like fall out of a tree and land on a jungle gym? I fell onto it.
Is it the roof of the jungle gym? Is it the floor of the jungle gym?
Right.
Is it the wall of the jungle gym? I think fall on might be like, if you're climbing rope in gym class and then you fall from there.
Mm-hmm. I get it.
Oh, see, then I used on and from in the same sentence. So maybe I just made sense of this whole thing in that last sentence I just said.
Albert,
I don't know.
I don't know.
Wild times.
Right. Jungle gyms, initial encounters, falls.
And it falls. Who knows?
Pure chaos.
All right, let's get into the news. First up, we have administration expands naloxone distribution. The New Jersey Department of Health signed 2 standing orders to drastically expand access to naloxone, the life-saving medication used to reverse an opioid overdose. They also launched the New Jersey Overdose Data Dashboard, which displays information about naloxone administrations, substance use treatment admissions, viral hepatitis cases, opioid prescriptions, and drug-related hospital visits. Public health professionals, law enforcement, researchers, journalists, and other community members will be able to use the data to inform their opioid response strategies, conduct research, and apply for future grants. So this is an update that kind of comes into what we talked about a few episodes ago about naloxone, which is a drug that's supposed to help with opioids. As an update to this story, manufacturing issue happened in Pfizer and halted their production of the single-dose injectable naloxone in April, which is kind of what I'm alluding to here. Pfizer said it may take until February before it can meet the demand again. Without supply, organizations must weigh in which facilities will no longer stock the antidote, which is scary.
That is kind of scary.
So there's a supply chain issue. I didn't know that, other than the vaccine for COVID, I didn't know that there was like supply chain issues for any kind of prescription drug or any drug in general. But could you imagine if there was like a supply chain issue with something like insulin?
No, exactly. Yeah. Something like a sort of a life-saving or life-preserving type of drug.
Life-preserving. Right.
Because
life-saving is one thing.
Right. Naloxone's similar to that, though. People who depend on that or who need that in order to either curb addiction impulses or whatever, that could be dangerous to not have that for a little while or to have it be harder to get because it might be easier to just go out and, find some heroin or something.
Yeah, exactly. So hopefully they might be able to speed this up so that people can get their lives saved. It doesn't seem like it, but, crossing my fingers. But it looks like New Jersey is starting to get ahead of the curb because they've got some time before they can actually get naloxone if this supply chain is as bad as it sounds. So hopefully, they're getting ahead of the curve and they can kind of get this ready to go once it's able to be more distributed.
Yeah, absolutely. All right. California's battle against tobacco. The UC Davis Center for Healthcare Policy and Research, CHRP, has received a $7.5 million 5-year grant that will allow them to lead a program that provides intensive training and technical assistance on smoking cessation in California. This program is called the Healthy Living Clinic Initiative, or HLCI. The HLCI will enable community clinics to follow proven quality improvement methods to increase the effectiveness of tobacco cessation efforts. This will allow for better assessment of population health metrics, such as smoking prevalence among the clinic's patients, referral rates, counseling utilization rates, and quit rates. Their team will use a novel whole health approach to support smoking patients, providing them with guidance on diet, physical activity, and stress management.
Interesting approach. I mean, $7.5 million 5-year grant, that's pretty substantial, especially for something that just seems like it's a more of an assistance program more than anything else.
Right.
So a lot of money to deal with this. So hopefully with the money, they can actually make something happen. Sometimes healthcare organizations will get grants and then find out that either it's not enough money or they don't have enough bandwidth to actually make it work.
Right. It's interesting too, because they talk about like tobacco use. Is that specific in regards to like smoking cigarettes, or is this,
I was thinking the same thing.
Are they talking about like vaping or like Juul or any of those sort of?
Yeah. I was thinking along the same lines. Hopefully it's about vaping, because I think Generation Z is like the first generation that is like really big smokers since like the baby boomers. So there's like a 2-generation gap in between baby boomers smoking and Gen Z smoking, and they smoke around the same amount. And what's crazy with vaping is people don't realize how much they're smoking in a day, because you're just hitting the one little pod.
Right.
And the pod is worth like probably a pack or two, and then smoking a pod a day. That's like insane.
Yeah. It's
a lot. They don't know much about it still.
Right, for sure. And so, hopefully this will help prevent some of that, or at least like get to the root causes of it. I do like that they included stress management. I feel like the world is pretty stressful, especially the last year and a half. I feel like maybe people who didn't smoke took up smoking because the stress of COVID and politics, all that kind of stuff. So hopefully this, this can help curb some of those habits that might have been picked up as a result of poor stress management.
Well, if you're a smoker in the area of UC Davis Center for Healthcare, make sure to, ask about this initiative, the Healthy Living Clinic Initiative. Anyways, next up, Medicare fraud settlement. A major California-based medical provider has agreed to pay a total of $90 million to settle allegations of Medicare fraud. Sacramento-based Sutter Health, Northern California's largest hospital system, got inflated payments because it said people in its Medicare Advantage plans were sicker than they actually were. The officials in the investigation said that the federal program makes larger payments for patients with more severe diagnoses. Moreover, Sutter didn't do enough to correct the problem once it became aware that it had been submitting unsupported diagnosis codes. Sutter said it paid $30 million to partly resolve the claims in 2019 and will not pay the additional $60 million to fully resolve the lawsuit without admitting liability. The total includes $60 million in restitution for the amount alleged to have been defrauded and $30 million in penalties. Whoa.
Yeah, that's a lot.
So this seems like this was already a lawsuit. They already paid $30 million to partly resolve the claims 2 years ago in 2019. And now they have to pay $60 million in restitution, but it doesn't sound like they want to pay the $60 million in restitution, which I wouldn't either, to be honest.
I guess you wouldn't. It sounds like they're defrauding the government, right? So it's a
Medicare fraud. So it seems like they were miscoding, and I don't know if it was
purposely.
Purposeful. It sounds like it was purposeful, and from the guise of this story that we're reading off of, it makes it seem like that Sutter Health was like, let's fraud Medicare, which is possible, but it's also possible that they didn't know, which is, that happens all the time. Either way, Medicare fraud happens a lot, especially with coding and billing errors. In this instance, it's a coding error because of the diagnosis codes that people were using. But it comes down to this healthcare in general is so complex that it's almost impossible to not have some sort of fraud happen.
Yeah, that's true.
So, I mean, if Sutter Health knew of this, shame on them. Because that's government money, that's tax money, that's people, everyday citizens paying for that. And if not, then it seems like they need to have a better auditing process. I think they probably need a better auditing process, regardless of which.
I think this would reveal something like that. Maybe our processes aren't working if we're paying $90 million.
That's bad.
Accused of fraud
for one.
Not just that,
a few mistakes.
But the PR on that, like whenever you see fraud in a headline related to your organization, that's not good either. So
no, not at all.
Definitely, you're going to want to re-examine some of that.
Yeah. I don't know how many people or how many patients claims were involved with this situation,
Yeah.
but it had to have been a lot if it's
Right.
this much money.
Yeah.
With that, let's go on to our next segment. Welcome to Breach Patrol. We talk about the latest breaches all across the world. Albert, take it away.
All right. This is an update on a story that we talked about previously. T-Mobile calls data breach humbling. A recent T-Mobile data breach coughed up the information of more than 50 million people, including some who aren't current customers or never even were. The hacker responsible for the attack already did an interview with the Wall Street Journal, calling its security, quote, awful, and now CEO Mike Savert is speaking out. The CEO said that keeping customers' data safe is taken very seriously. He also said that it's a top priority. However, T-Mobile has had at least 5 breaches since 2018. That includes this one, 2 in 2020, and 1 each in 2018 and 2019. To do something about it, T-Mobile is partnering with cybersecurity firm Mandiant and consultants at KPMG to tighten things up.
Wow. So the CEO finally, it seems like the CEO of T-Mobile was, called out enough where he was like, all right, I'm going to say something. And he goes, this is a humbling experience. It's
Right.
Like, I don't know if humbling was the right word for that.
Right.
Especially after 50 million people were breached and you've had a breach for the past 4 years.
Right. Not to mention you have the hacker out there like doing a media circuit. Like, yeah, these guys have terrible security.
Media circuit. He's
like
he's touring the United States. He's
right.
on,
just bad mouthing your security. Right. He's on Jimmy Fallon talking
he's
about
like
how
a
bad
celebrity.
Right.
Jeez. I mean, what a PR disaster. It seems like they need to overhaul the PR and they need to overhaul their security. And they need to tell their CEO to never say something like that ever again.
Right.
That just seems like a bad look.
Yeah, it's a bad look all around. Not great, T-Mobile. Get it together.
Hopefully, the data that was leaked, I don't remember it off the top of my head, but the data that was leaked, hopefully it wasn't too terrible. And if it's kind of coming back to me, I don't think it was that crazy, but I did think it had payment information involved, which if it ever has payment information involved, it's pretty bad news. So
right.
It does seem like it was actually pretty bad. Next up, DuPage was due next, apparently. The DuPage Medical Group, also known as DMG, is notifying patients about a data breach on its security. DMG experienced an issue last month that caused a disruption to its network systems. Through an investigation, it was determined that the network outage was caused by unauthorized people who gained access to the DMG network. Officials found out later that certain files that contained patient information had been impacted by this incident. DMG is in the process of mailing letters to people whose information may have been involved. So DMG, they responded the right way in terms of they let officials know, they let the media know, and they're letting the people who were involved know. Hopefully they have the right addresses of these patients who are being involved. And if they don't, hopefully they can notify them via their website or send them an email or something, because that could be a whole nother mess if they don't do it the right way.
Absolutely.
It doesn't say how many people were impacted in this, which means that they're still trying to figure it out. It seems like DuPage Medical Group might have not taken this attack as seriously at first and then realized that it was bad, and they were like, oh no, we got something on our hands, folks. We got to talk about this.
Yeah. All right. Bangkok Airways apologizes for passport info breach. Bangkok Airways has publicly apologized for a data breach in which the passport information and other personally identifiable data were leaked. They stated that the breach was discovered on August 23rd. The airline has not released any information regarding what time frame the data came from or how many customers were involved in the breach. They did confirm that the names, genders, phone numbers, contact information, email addresses, partial credit card information, and more were accessed. Bangkok Airways is still conducting an investigation into the attack to understand the full effects. The airline also stated that it was working on strengthening its IT system and identifying potential victims. It seems here like they are still trying to sort of get their head around what happened. Not too much information yet. Not quite sure whose data was leaked or who was affected by this, but it does seem like they're taking the steps to try to confirm all of that.
Yep. They're still in the midst, if you will, of trying to figure everything out.
In the thick of the investigation.
Into the thick of it.
Can I sing that on here? Are we gonna get sued?
Demonetized?
Backyardigans or something?
The Backyardigans are gonna come. I don't know how many people fly on Bangkok Airways. I didn't even know that Bangkok had an airways called Bangkok Airways.
Yeah, same.
Let's see how big they are. I don't know. 36 aircraft. Okay.
Well, that's
average fleet age is 11 years. So we're talking about older planes here. Employs 3,000 people. So that's good.
That's nice. Yeah.
So they are a pretty big airline. Hopefully it's not that many people that are breached.
Right.
Credit card information. This is like standard protocol here. Names, genders, phone numbers, contact information, addresses,
the basics.
Credit card information, and more. So I don't know what the more is, but
oh boy.
Also partial credit card information. Hopefully Bangkok has something like PCI in place where the credit card information that's given out isn't that sensitive. Maybe it's only a few digits, but the thing
everything's encrypted at the end or something.
Yeah. The thing is with this is hopefully, I mean, it's still bad because what they can do with this information is they can call the credit card company and say, hey, I'm so-and-so, blah, blah, blah. I need this information. And they can kind of verify that they are who they say they are, even though they aren't who they say they are. And get the information that way. So hopefully the credit card companies are good.
Yeah, a lot of places only ask the last four of the credit card sometimes. So
yeah, it's true.
If you get a hold of that, you can access a lot.
Yeah, and phishing attempts, of course, with email addresses. So if you've flown Bangkok Airways within the past few years, stay alert.
Yeah.
And that's it for this week's wrap-up of your weekly healthcare news. I'm Matt Moneypenny.
And I'm Albert Battistelli.
And we'll see you next week.